The characteristics and applications for education. What are the characteristics of individuals with severe The characteristics and applications for education. What are the characteristics of individuals with severe disabilities and how can we support them? Severe disabilities refer to conditions that severely limit a student's capability to learn and participate in education. These disabilities can arise from cognitive, physical, sensory, or behavioral challenges that require tailored educational strategies. The IDEA, or the Individuals with Disabilities Education Act, is a federal law ensuring students with disabilities receive free and appropriate public education. IDEA emphasizes the importance of providing specialized services tailored to individual needs. There are cognitive challenges that individuals with severe disabilities may experience, including limitations in reasoning skills. These individuals may struggle with logical reasoning, making it difficult to connect ideas or understand abstract concepts. Such limitations hinder not only academic performance but also daily decision making skills. The impact on problem solving abilities. Cognitive limitations can significantly restrict problem solving abilities, particularly in unfamiliar or complex situations. Students may apply or may not apply learned strategies effectively, affecting their independence and capability to navigate everyday challenges. Memory impairments are common among students with severe disabilities, impacting the retention of information and learning processes. Difficulties in remembering tasks or instructions can hinder their ability to participate in educational activities and daily living. Physical and sensory limitations, including orthopedic impairments, can hinder mobility, fine motor skills, making it difficult for students to engage in routine classroom activities. These impairments can arise from conditions such as cerebral palsy or spinal cord injuries requiring specialized equipment and support. Vision loss varies in severity and can range from partial sight to complete blindness. Students with vision loss may need braille education, audio materials, and accessible technology to access the curriculum and participate effectively. Hearing loss impacts a student's ability to communicate and comprehend spoken language, affecting their interaction with peers and educators. Specialized services such as sign language interpreters and auditory training are critical for academic success. Impact on mobility and access to education. Physical and sensory limitations can severely restrict mobility, making it challenging for students to navigate school environments and interact with peers. Enhanced accommodations are essential to ensure equitable access to education opportunities for all students. How do we address behavioral challenges, such as self-injurious behavior? This includes hitting, biting, or headbanging, and these are often seen in students with severe disabilities. These actions can stem from frustrations, lack of communication, or sensory sensitivities, requiring tailored strategies for intervention and support. Aggressive behaviors can manifest as physical violence toward others or property destruction. Understanding the triggers, providing consistent routines, and implementing positive behavior support are crucial to preventing and addressing these challenges effectively. The need for specialized interventions. Students with exhibiting self-injurious and aggressive behavior often require individualized support plans. Strategies may include behavior modification techniques, sensory integration therapy, and collaboration with mental health professionals to enhance coping mechanisms and communication skills. Communication difficulties. Many students with severe disabilities struggle with communication, making it difficult to express their needs or understand complex language. These can lead to frustration and behavioral challenges, requiring tailored support and interventions to improve communication skills. There is an alternative communication strategy. and the implementation of alternative communication systems such as picture exchange communication system or PECS or generating devices can significantly enhance students' ability to communicate effectively. These strategies promote interaction and reduce frustration by enabling students to express their needs more clearly. Students with severe disabilities often demonstrate limitations in adaptive behavior, impacting essentially daily living skills such as eating, dressing, and hygiene. These deficits can hinder their participation in educational activities and their ability to live independently. The impact on independent living and education. The combination of communication difficulties and adaptive behavior deficits creates significant barriers to independent living for students with severe disabilities. These factors necessitate comprehensive educational strategies that focus on skill development and support greater autonomy. How can we support individuals with severe disabilities? Supporting individuals with severe disabilities require a multifaceted approach encompassing individualized needs, accessibility, and inclusive practices. It involves creative supportive environment, fostering independence, and promoting social inclusion while respecting individual choices and preferences. First, we have to prioritize independence and empowerment by allowing them to make their own choices, encouraging them to make decisions and self-determination in daily activities. We provide assistive technologies, offer tools and devices that can help them live more independently, and we foster independent daily tasks, like supporting them in taking on tasks like dressing, eating, and bathing as much as possible. Number two, we must create accessible and supportive environment, which is ensuring physical accessibility, making sure homes, workplace, and community spaces accessible to those with disabilities. We provide clear and simplified communication, use simple language, visual aids, and assistive communication devices when necessary. We also offer emotional support by being patient, understanding, and empathetic, and offer encouragement. And we promote healthy living by encouraging them to exercise regularly, eat balanced diet, and encourage other healthy habits. Third, we have to foster social inclusion and connection by creating opportunities for social interaction. We facilitate opportunities for community involvement, recreational activities, and friendships. We advocate for inclusive policies by supporting policies that promote equal rights and access for people with disabilities. And we build a supportive community by connecting with their families or other families, support groups, and professionals who can provide guidance and assistance. Fourth, focus on person but not the disability. Treat individuals with respect. Speak to them directly, not through their caregiver, and avoid patronizing behavior. Recognize their strengths and abilities by focusing on their potential and encourage their participation in activities. Avoid assumptions. Don't assume that they can't do things just because they have a disability. Ongoing and learning education is the fifth. Educate yourself about specific disabilities. Learn about specific needs and challenges associated with each disability. Stay informed about best practices. Keep up to date on current support strategies and interventions. By implementing these strategies, we can create more inclusive and supportive environment for individuals with severe disabilities, allowing them to live full and meaningful lives. Thank you.